All right, hey guys, this is just a quick training video. I know there's been some discussion on patient refusals. I'm going to go through the policy and procedure, the protocol for this real quick. Um, so, and then I'm going to touch on some key points as far as when we accept them and the documentation for the actual refusal itself. So, any adult patient who may give consent for treatment under Protocol 1.04. Consent for treatment who is in possession of his or her mental faculties, such as them being alert times 4, so person, place, time, or event, may refuse treatment of care. If we were to force any kind of treatment or transport that's kidnapping, assault, battery, we can be held legally liable for that. If any patient decides that they don't want to go, we will take such action as to make sure that we do an assessment on those folks and that the proper paperwork is filled out. Some key points that I wanted to discuss to make sure everybody's clear on. A couple of scenarios in which, so one of the following, if non-EMS certified folks arrive on scene prior to any first responder or incoming medic, the injury is minor, let's say a cut finger, stubbed toe, anything that does not require an advanced life support assessment or intervention. We may reduce those units to code 1 if they're not already responding non-emergent, and then we will let the incoming first responder make his or her assessment and either cancel the incoming medic or have them continue. EMS first responders who are on scene already before the medics arrive, again, if the injuries are minor and they do not require ALS intervention, as stated before, and feel comfortable doing the patient refusal, they may obtain that patient refusal and cancel the incoming medic. Do not feel that by canceling an incoming medic, by them changing their mind and continuing, that is on their decision. If for some reason medic is on scene prior to our arrival of first responders, I do not want our first responders obtaining that patient refusal, especially if you're 10 or 15 minutes before getting on scene and they beat you on scene. That medic has made contact, made their assessment, and developed a rapport. If something happens and we take liability on that patient refusal and it's something that ambulance crew missed, we're held liable for that. So again, if you are not on scene, or if the medic is on scene before we are, and you have not been able to do your assessment, do not obtain that refusal. Non-medical personnel, if you arrive on scene and you get there, it's an NVA, for example, 1, 2 vehicles, doesn't matter. If no patients are on scene, you've seen them transported by another vehicle, PD's gotten on scene with you, and you've been able to verify there's no patients on scene, you can advise the incoming first responders and medic crew that you have not located any patients on scene, and they may cancel. They still may want to continue, but you are able to do that as non-medical providers. So on to filling out our forms. Everybody's seen a patient refusal form. It's not very detailed, and I hope to in the future get this a little bit more detailed. Once these forms are completed, there are mailboxes at Station 2 and Station 1 that are marked patient refusals. Make sure that these are filled out to their entirety and put in the hard copies in the mailbox. A full assessment is done and entered into Firehouse with at least 2 sets of vital signs. So this does not take place for the Firehouse report. This is done in conjunction with the Firehouse report. The Firehouse report does not have the ability to do electronic signatures. This is the only thing that has that actual signature on it. So please do, this needs to be done. It's very important. Again, if you have any questions, please let me know. That's it.